Crews are working around the clock, removing what once were the walls of the Care Regional Medical Center in Aransas Pass. On August 25th, Category 4 Hurricane Harvey cut a path of destruction that devastated the Texas coastal region and the medical center known by locals as CRMC. Harvey heavily damaged the building, leaving thousands of people without health care. Doctors, like family physician Dr. Lawrence Bailey, are desperately trying to reconnect with displaced patients from this makeshift office.
I'm still in a state of shock, not really denial, but there's so many problems to deal with simultaneously that it's hard to focus on just one. Yesterday was my first time seeing patients, and I really tried hard to focus, and I think I did a fairly good job, but it was not easy.
Room by room, staffers painstakingly pick up the pieces to bring the empty shell of this care facility back to life to care for more than 90,000 patients once again.
Doctors always have a responsibility to their patient. It doesn't matter if there's a building or not.
Radiologist Dr. Isabel Menendez weathered the storm at home with her family. Only later did she learn the full extent of the damage.
I drove by the Sunday after the storm, and just looking at the outside, I thought, oh good, the hospital made it. And I thought I was going to be back on Monday when they called me and said, nobody can go into the hospital. It's devastated.
The building's reinforced exterior walls withstood Harvey's hurricane-force winds, but the tile roof gave way, flooding the interior with 3 feet of water. The tools of medicine, including X-ray machines, CT scanners, and computers, were ruined. Standing water destroyed the emergency room, nursing stations, and offices. The adjacent clinic, once a hub of healthcare, is now a construction zone. Every exam room was damaged. Thousands of patient healthcare records, once underwater, are drying out, but the threat of mold is a constant health hazard. There was some good news. The medical center's servers sustained little damage. Phone and internet service were spotty at best.
Hi, this message is for Ida. It's Victoria, Dr. Bailey's office.
But clinicians set up a makeshift phone system so patients could call during the critical hours after the storm.
All the phone calls were being routed to one cell phone number, and that cell phone number was able to reach out to all of our patients and make sure they can reach out back to us so that we can actually, help them with prescriptions and medications and anything they might need.
CRMC remains closed indefinitely, but administrators vow to rebuild the hospital. The emergency room and patient intake areas are the first priority, but tons of debris must be cleared before reconstruction can begin. This scene is repeating along the Gulf Coast and southeast Texas as thousands of medical clinics were damaged or destroyed. Nearly 2/3 of physicians in the disaster counties told Texas Medical Association they had to close their practice at least temporarily.
Acting as a physician, once again, has been cathartic.
For Doctors Bailey and Menendez, the personal and professional recovery will take time, but each day restores their faith in the family and practice of medicine.
We've all gone through hell, so I think getting back to work has given a little bit of normalcy to our lives, which for the last 2 weeks has been extremely abnormal.
Some of my friends from the TMA and on council, different councils have called or texted me or emailed me, wanting to know what the situation, because they realized that it was something that we weren't ready for it. We didn't expect it. It seemed like it came pretty quick. But we never lose hope. Hope is always, there's always a calm after the storm. And so the sun will shine again, and we hope that we can provide the services again for our community.
The doctors and staff are locating and contacting more patients each week. Until the medical center can rebuild, they are redirecting patients to affiliated clinics in Rockport and other neighboring cities. But one day, CRMC's physicians and staff will welcome those patients back here for care.